Good morning, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Doing just great, thanks.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, public health, and infectious disease question here each week on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions, addressing the latest headlines, and our lone U.S. COVID statistic through today, October 4th. We invite you to submit any questions or suggested topics down below via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Starting with our abbreviated COVID statistic, in the last reported week, there were 127 daily COVID deaths. In the same week in 2023, we saw 201 COVID deaths. Dr. Murphy, your reaction to those numbers as well as the state of COVID in the country?
Yeah, so we're coming off this summer bump. We have the summer bump every year, apparently. And although the death rate is high, which translates to 46,000 people per year, it's much lower than it was a year ago, which was 201 cases, so significantly higher. And remember, the death rate is the last metric, obviously. So the good news, when you look at the wastewater measurements, the Sentinel wastewater thing, it's gone from very high everywhere to high, and this week it's moderate to high. So, you know, it's coming down very nicely. What is going to happen, though, there's going to be a winter wave as well that starts in December and January. The same KP.3.11 variants are out there, accounting for about almost 60% of all the COVID infections. But in Europe, they're noticing a new variant called XEC. XEC, the letters. And it's responsible already of 13% of the German cases and 7% of Britain. So it's interesting that it looks like these waves, you know, they're getting picked up where they're see, a lot of places aren't testing for this, but they get picked up in Western Europe, then they come over to the East Coast, and then it goes to the West Coast and the rest of the country. That seems to be the way it's going. Doesn't look like it's any different. It's an Omicron variant. It's a combination of a hybrid of KP.3 and KS.1.1. And you know, it looks like it's behaving about the same. And as soon as it goes over 1% in the United States, they'll start reporting that out. But you know, it's no big difference and doesn't impact, we think, the clinical presentation or the impact of the vaccines. Now, the vaccines that are out there now are more against the Omicron variant. So this new vaccine that's available now should be the one that you're taking and will work better against these Omicron variants.
Speaking of this season's vaccine efficacy, we just got some new data regarding this year's flu vaccine. Can you share the numbers with us and tell us a little bit more about exactly what those numbers mean?
Yeah, these numbers have been on the national news recently, saying that the current flu vaccine probably works about 35% of the time, because the flu season is in the southern hemisphere was, you know, 6 months ago. So they looked at the effect of the vaccine that the global authorities put together for this year, and it looked like overall it was about 35% effective, and that's a little bit lower than usual. But there's a couple caveats. It shouldn't discourage people from taking the flu vaccine, which is, I'm afraid, the way the reporting it sounded like. Oh, it only works 35% of the time. Why bother? Why bother? Because 35% translates to 105 to 240,000 hospitalizations and deaths. We'll track with that as well. The other thing is, if you look at people really at high risk, the efficacy is 59%, almost 60%. So going from like 1/3 to almost 2/3 based on your risk, but still everybody is getting some kind of benefit. And, it's certainly better than zero. You
Absolutely.
don't take the vaccine, zero benefit. So please take your flu vaccine. It is approved for everybody 6 months of age and older.
Mhm. And before we move on from this topic of vaccines, we had a really, really great submitted question this week from one of our viewers. They asked, does taking ibuprofen or acetaminophen, so your Tylenol, your Advil, dampen the effect of either the COVID vaccine or the flu vaccine?
This is a good question, because it had been thought that, well, Tylenol does hardly anything anyway, maybe a little pain relief, that's safe. But the anti-inflammatories, like the NSAIDs, the anti-inflammatory drugs like ibuprofen, which is over-the-counter, Advil, and those kind of drugs. They say, oh, that's an anti-inflammatory, and you're trying to actually cause a immunologic reaction, and maybe there's some blunting of the response of the vaccine and the treatment. And a nice little study was done and published and found no evidence that any analgesic reduces the antibody response to the COVID vaccines. And basically they did studies in over 2,000 participants who were surveyed. They looked at their antibody levels, whether they took analgesics or didn't take analgesics, whether they had symptoms or didn't have symptoms. And for COVID anyway, it didn't have any effect at all. So there's no literature evidence really to say that taking any analgesic is going to be bad for you. So you get some fever or aches or something from your vaccine, go ahead, you can take it. It's going to respond just the same.
Well, that really is great news for those of us like me that do have those reactions to the vaccines. So that's
Yep.
good to hear. But we got another great study, some big news, this time regarding RSV in infants and a new antiviral drug that could help prevent the disease. Can you tell us about it?
So RSV in infants is really devastating. It fills up the pediatric hospitals. Children can die from this. We talked about giving them Beyfortus, this monoclonal antibody, vaccinating the pregnant mothers in their third trimester so they will make the antibody and give it to the kid. That works too. But there's no real treatment if some kid does get RSV, and they're the ones that are really at risk. So this is a report that from the Chinese, reporting of a drug called Zaricivir. And it was used in this study, and how many people are in this study? It's 164 participants received the drug, and 80 received placebo, so 244 participants overall, which they're calling a phase 3 trial in China. And they used this scoring system to see if people were better, which is probably basically how the kids are doing. And, the kids that took the drug did better. Now, the problem with this so far is that they also saw a small viral load reduction in the people that took the drug. So it is an antiviral, so it's supposed to do that. And so the scale they use to measure has not been fully validated. And so there's some caveats here. So, this drug has a long way to go before it's ever going to get approved in the United States, but it's a promising start. And they'll probably now test it here in kids.
Absolutely. And I do need to correct myself as I thought that was for prevention, and you clarified it was for treatment.
Yeah, it's for treatment.
Wow, that's really excellent. And another big story this week that has been talked about a lot, not only by us, but the national media, is this puzzling potential cluster of human H5N1 avian flu cases. Can you bring us up to date on all that's happened?
So what happened was there was this Missouri case, it's reported over a month ago, I think, of person getting avian flu who had not worked on a dairy farm or worked with birds, was not in the agriculture or animal industry at all. So that was very concerning because we know that avian flu in humans can be really bad. So then it turned out there was another person in that household that got sick, but that person didn't get tested. And then there were four of the additional healthcare workers who developed symptoms who also weren't tested. Something. So they haven't really confirmed these other cases, but they've been investigated now. And the risk of transmission is still considered very low. And none of these people have gotten that sick, and nobody has died. So, something is different because the fear always had been in this reports from Asia in the past that people who got avian flu from working with birds primarily, there was a 50% mortality rate. So everyone has been so concerned about avian flu. So, we've got these cases here in the United States. There's been 13 confirmed. Nobody has died, and the symptoms have been relatively mild. So something is different. There's been no avian flu related deaths reported so far in Americans, and they're really these mild cases. So something is different here about the avian flu. But anyway, more work needs to be done. And they have to figure out why this whole Missouri investigation really has been really so inadequate. We got to do better than that. But remember, it's all up to the states to do this. And I have no idea about the situation in Missouri or how it was investigated, but there's a lot of unknowns there. But the end result, nobody has died, but we really don't know how many cases there are because not only one is confirmed.
Mm-hmm. And some of those healthcare workers and the household contact were able to give blood tests for antibody testing, but of course, those take a lot of time. So we might get those results by mid-October, and when they're out, we will share them. Absolutely.
We will finally get some results from these because these people will be followed out with very specific tests now that the CDC is involved.
Mm-hmm. Now, another instance where there is a big global movement around something is the Mpox outbreak that have been occurring in Africa and globally since 2022. There recently was movement with the WHO approving, finally, the vaccines. Can you tell us about the movement of those vaccines and the status of the outbreaks?
Well, there's over 30,000 suspected Mpox cases and more than 800 deaths. I mean, it's been a tragedy in especially Congo. So this has been going on for months, and this week the first donated or purchased or whatever vaccines have made it to Congo and are being administered to actual humans. The Africa CDC, which was started after the Ebola epidemic, predicts that or estimates that at least 10 million doses are going to be required to extinguish this outbreak of Mpox, which is primarily due to this clade 1b that's floating around now. So the U.S. has announced, and we've reported this before, a $63 million order for the Jynneos Mpox vaccine. And President Biden just announced that the U.S. would be donating 1 million doses of this vaccine and at least $500 million to African countries in support of their response. So this is, okay, things are finally moving. But, if this was even, if it was more lethal or spread even more rapidly, I mean, this has been a really unfortunate delay from the time the problem was recognized to the time the first person gets vaccinated of a preventable disease. This is it was not a good exercise in how well we do with these kind of problems. So, there's many issues here. I'm simplifying things maybe a little bit too much, and things are finally moving. That's good news.
Yes, that is the good news. And looking back here to the US, we've been talking a lot about mosquito-borne illnesses here and abroad. But can you give us an update and idea of the scale of those diseases we're seeing here this year?
Yeah, mosquitoes are causing all sorts of trouble, and this year was a bad year because the mosquito population is higher than usual because of the changing climate and that they have more places to live and spread and whatever. So let's take them one by one. So West Nile virus, which is pretty much only diagnosed if you get really sick. So there's quite a bit of West Nile virus that, you get sick, you don't think anything of it, you get better. You don't know how many of those people have West Nile virus. The more you look, the more you find. So as of October 1st of this year, 880 cases were confirmed, including 605 neuroinvasive cases. That's like they had encephalitis. So the sicker you are, the more likely you are to get diagnosed. At least 18 people have died from this. So it's a potentially lethal disease. Now, it's not just 880 cases, it's probably 100 or even more times number of cases. So we don't really know the proportion of people that die from it. So that's West Nile. There's also Zika, chikungunya, and dengue. We have more information on dengue. In 2024, there were 5,608 cases. This was up from 3,300 in 2023. And most of these people had traveled to high-risk dengue areas like the Caribbean or Brazil. Brazil was reporting the most cases. It was this huge wave of dengue cases in Latin America and South America. But there have been 5 de novo cases in the United States. The 5th one was reported in California just recently. So you don't even have to travel anymore to get dengue. You can just get it in the United States. So that's dengue. Then there's EEE, Eastern Equine Encephalitis virus. This is a little nastier one, has a mortality rate of 30%. When they find EEE, I mean, they close forests and areas and everything because of the potential for dying. So the number of cases is not very high. In 2023, there were 7. In 2024, that almost doubled to 13. And of the 13, at least 2 people have unfortunately passed away from the disease. We don't know if any more will die or not, and the expected mortality is somewhere around 30%. So you have to just be careful with these mosquito-borne diseases.
Mm-hmm. And speaking of rare things to potentially be careful of, there was a report of a person who died from rabies in the United States recently. Can you tell us about the case?
Yeah, this is most of the people that have died from rabies, are out of the country and don't have access to the rabies therapy and vaccines and stuff. But this 65-year-old was in Minnesota, was bit by a bat and didn't get the treatment and died. I mean, if you get to the point where you actually have symptoms, almost everybody dies. It's a nasty, nasty disease. So this is only, like I said, the 5th patient since 1975 to actually die of rabies in the United States. So, people have to remember, if you get bit by some wild animal or something, go to the emergency room and get the treatment. Because if you take it while you have no symptoms, it works very well.
Mm-hmm. Very scary. And looking forward to a future issue we hope does not plague us here in the United States, there's been a recent update on the Pasture Act, which in Congress is aimed at antimicrobial drugs. Can you tell us about that act and a little more specifically about what this will do to help us in the future?
Yeah, no, this is really a good bipartisan effort by Congress and the HHS, the Department of Health and Human Services, to enter into subscription contracts for critically needed antimicrobial drugs. $6 billion has been appropriated for activities under this bill. So totally bipartisan. supported by multiple foundations and groups of stakeholders in the country, to keep a stockpile of important drugs that can be used in the case of people with resistant organisms. It's just a great thing to do. It's a smart thing to do, and can save lives.
Absolutely. And hopefully it can show all of us that we can all work at this together and stay safe and stay healthy.
I mean, they estimate actually that 64,000 Americans die every year because they don't have the adequate medication to treat their infections because it's resistance. So it's these 64,000 patients that this is directed against. So this is really, it's a very positive thing, and your government in action. So this is the only this is the only way it can be done.
Mhm. We will keep our eyes on it, and hopefully this will progress positively as it has done. But on that note, thank you so much, Dr. Murphy, for your time and your expertise, answering our viewer submitted questions, breaking down the latest headlines and data. It's much appreciated.
Great. Thank you, Katie, and have a good weekend.
Thank you. And thank you all for joining us for this week's episode of the Ask Dr. Murphy series. We hope to see you again next week. And as always, if you have any questions or suggested topics, please leave them down below or at any of our social media linked in the description. Have a great weekend.